Myelofibrosis, perkataan yang mungkin pernah didengari tetapi tak tahu pun ini penyakit kanser ke bukan kanser ke. Ia jatuh di bawah kategori penyakit jarang dijumpai ataupun rare diseases. Sejujurnya, doktor pun boleh terlepas pandang simptomnya kadang-kadang, dan sebenarnya honestly lah, saya pun tak adalah arif sangat dengan penyakit dan juga simptoms myelofibrosis ni. Jadinya hari ini saya akan bawakan seorang tetamu yang sangat istimewa, sangat arif dalam mengesan dan juga merawat penyakit myelofibrosis ni, dan juga sangat-sangat berpengalaman, tak lain tak bukan Dr. Ng. Hi Dr, nice to finally meet you. How are you today?
Fine.
Doctor, I've heard a lot about you dan juga pengalaman Dr. Ng in hematology field. So, can you share with us a little bit your journey and also experience in medicine and in hematology?
I've been in practice for the past 45 years. So this is a long time, almost half a century.
That's my age, okay.
Currently, I'm working as a consultant hematologist at Subang Medical Center. I'm also the medical director for the Central Diagnostic Lab in the same hospital. Since this year, I've been appointed as a young professor in University Utah. Says University Tunku Abdul Rahman.
Okay, Dr. Ng, jumping right into myelofibrosis. My viewers said, diorang dah Google, they have searched online. We are not sure myelofibrosis, is it penyakit kanser ataupun penyakit bukan kanser? Is it in between? Can you explain to us, Doctor?
Myelofibrosis should be considered a serious bone marrow or blood disorder, but it is not cancer, not yet. Meaning that myelofibrosis has the potential to turn cancerous given time. But strictly speaking, at the point when you diagnose as myelofibrosis, it is not a cancer yet.
Alright, maksudnya ia adalah penyakit yang berkaitan dengan darah tetapi belum berubah menjadi kanser. Jadi dekat negara ni kan doktor, kita ada banyak penyakit berjangkit, banyak penyakit berkaitan dengan darah. We are rich with dengue, we are rich with malaria, we are rich with a lot of infectious diseases and non-infectious diseases which may have a lot of variety of symptoms. Now, apa symptoms yang spesifik untuk myelofibrosis, dan when you think doctors, frontliners and patient themselves should think that this could be myelofibrosis till proven otherwise?
I think the key symptom or signs that you could pick up, number one is unexplained anemia. And usually that's been going on for some weeks or months. So it's not something in a week or two, but it is for some time. Secondly, if you examine the patient carefully, you notice you can feel the spleen that's enlarged. So you have a combination of unexplained anemia and splenomegaly or enlarged spleen. I think that's a red flag that you should think of myelofibrosis as a possible diagnosis.
Alright, so kalau saya sebagai doktor in emergency department or my colleague di klinik, so they find a patient yang ada unexplained anemia and all the symptoms related to it, dan ada limpa yang besar, splenomegaly. Apakah investigation lanjutan yang patut mereka buat? What are the variety of diagnostic investigations that one should do, and what is goal diagnostic tool?
I think the immediate thing is to order a full blood count together with a peripheral blood film. I think it's commonly known as full blood picture. Basically, we expect to see a blood film in the blood film. There's a medical term called leukoerythroblastic picture, whereby you see some immature white cells coming out in the blood film together with the nucleated red cells. And also there should be, usually you can find presence of teardrop cells. That means abnormally shaped red cells that look like teardrops. So I think if you have that present, I think then that raises the possibility of myelofibrosis to the next level. In which case, then we should organize a bone marrow examination. Bone marrow examination, basically you want to suck out some marrow, and also you want to do a fine biopsy. I think the diagnostic certainty actually comes with the bone marrow biopsy. That, as we were speaking a while ago, should be done by an experienced doctor, because technically, probably this is the most difficult bone marrow examination that we could encounter. It's very hard to suck out the bone marrow. It's also far harder to cut out the section of the bone marrow.
All right. Earlier, doctor, you said that one should be suspicious of MF if there's unexplainable anemia and coupled with splenomegaly. Now, what are the usual clinical symptoms, symptoms that patients go through that they end up coming to a clinic?
I think the symptoms of anemia will be patient feeling tired. There may be shortness of breath on exertion, or even when it's severe enough, even at rest. Patient may get giddiness attack when they stand up, and they just don't feel right. Symptoms related to the enlarged spleen include painful left hypochondrium because of the enlarged spleen. They can also feel that their stomach is bloated stomach. And last but not least is the constitutional symptom associated with myelofibrosis. Patients tend to notice they lose weight, appetite as well, not too good. They can have fever, they can have night sweats, and also unexplained pruritus, intense itchiness. So that those are the things that would again raise us the red flag that possibly patient could have myelofibrosis.
All right, so if they have the symptoms with unexplainable anemia and splenomegaly, then you said we should go into gold diagnostic procedure. Yes. Where mengikut Dr. Eng cakap tadi, kalau kita dah ada gejala ini, bacaan full blood count yang tidak normal dengan pemeriksaan doktor yang mengatakan limpa besar, apa yang wajar dilakukan adalah ujian darah serta tengok darah bawa mikroskop tu kita panggil peripheral blood film. Jadi ada banyak pakar pathologist yang boleh tengok bentuk saiz sel darah tersebut dan mungkin akan ada suspicion di situ. Then now doctor, lepas dah diagnose, okay, this is myelofibrosis. Apakah next step? Apakah rawatan? Adakah semua pesakit perlukan rawatan? Perlu ubat ke, injection ke, kena masuk ward ke, ataupun ada approach yang berbeza untuk pesakit yang berbeza?
I think the patient should be referred to hematologist for assessment. As you mentioned, this is a rare disease, so the general doctors may not have enough experience to manage this group of patients. I think when we see a patient, the most important thing for us to figure out is whether this patient belongs to a low-risk group, intermediate risk group, or high-risk group, because the treatment will be quite different. Of course, the other factors that come across our mind is the general fitness of the patient, whether patient got other medical problem as well. And what is the immediate problem? Is the patient severely anemic that need transfusion, or the patient is fit enough to be managed as an outpatient for you to further work out? So I think if you have workout patients belong to the high-risk group, this group of patients, the first thing we ask ourselves is whether this patient is a bone marrow transplant candidate. There are some patients that are young enough, usually those less than 60. Of course, nowadays the transplant age has been raised to as high as 65, but for the very old patient, bone marrow transplant is not an option. I think when you touch 70, it's almost a no-go. So that's the first thing we ask ourselves. If you think that patient probably will benefit from transplant and a high risk, then they should be worked up separately by the transplant physician. So that's the first thing. The second thing, we look at the intermediate group and also a small group of patients that have very few symptoms, then we'll decide what is the best treatment for the patient. I think if the patient had the symptoms, meaning that there are symptoms of anemia, they have enlarged spleen, they will need treatment. And the treatment of choice is the JAK2 inhibitor. And what the drug will do is it will reduce the size of spleen. It will improve the symptoms overall, meaning that patients will feel better. I mean, they actually work very fast. It was strikingly good. Within a week, the patient will say, for some reason, I feel much better. And that symptoms actually were symptomatic relief will actually continue to improve. So if you take away the symptoms, patients' quality of life will improve tremendously. And also the fact that they improve their general health status overall, meaning that their weight loss will be improved, they can eat better, their nutritional status improve. That also means that they will be less susceptible to infection and they grow their muscles. And since this MF occur in an older age group. Some of them will tend to fall if their muscle is weak. So by and large, there's actually, we can see survival, overall improvement in overall survival if they are on the JAK2 inhibitor. The other treatment that's important, supportive treatment are important is, some patients may need blood transfusion initially. Some patients have other medical problems. If they have hyperuricemia, that's usually exacerbated, got worse during the time MF. They may need treatment for the gout. And the other medical problem like old enough, you have ischemic heart disease, diabetes, all these need to be treated concurrently with the MF.
Okay, all right. So earlier, Dr. Ng said that MF is not typically cancer, but it can transform into cancerous form. So, but you also mentioned that if they treat MF aggressively, properly, then their quality of life improved tremendously. So, I realised that out there, ramai pesakit yang rasa bahawa MF ni bukan kanser pun, tak payah rawat pun, no need to do anything. And they feel that it's okay if, since it's not malignant, not cancer, I don't have to do anything with it, I can live with it. Apa komen, Doctor? What is your message about this, especially regarding quality of life?
I think no mistake about it, the symptoms will get progressively worse if untreated. Meaning that the patients, if they are anemic, already had symptoms of shortness of breath and so forth, the anemia will get worse. So their hemoglobin can drop further such that their activity will be restricted and so forth. Now the biology of the disease, of course, is also a moving train, meaning that those patients in the intermediate or certainly in the high-grade group, as time goes by, the disease can transform. So this group of patients need to be monitored, needed to be treated, and like we mentioned earlier, a small group of them may benefit from transplant, so they should avail themselves to the procedure which potentially is life-saving. But for the big number of patients out there, they will derive improvement from their quality of life, and they can go about doing their job. I have a patient who's 70 years old and managed to climb the Mount Kilimanjaro, something that you and I...
That's how much their life improved, actually?
Yes, I think so. Not only we add years to life, but we add quality to the years.
And I heard you mentioned they have to be monitored, they have to be managed multiple times, and you're not just simply talking about medicines or jabs, you're also talking about monitoring and management. So what do you do during follow-ups? What do you ask them? How are they managed actually, Doctor?
I think, of course, the symptoms that they have, we have to go through, whether they still have loss of weight, whether they have fever, fatigue, and so forth. So there's this book that... MPN 10 score. So I cannot remember all of them, I have to refer to them. But the nurses are very good at that. So they will show to the patient and they would kind of tick them, and that will give you some idea how the patient is progressing.
Right,
Yes.
all right. And I have a few questions that popped into my mind while you were saying. So you said that, transplant age has been moved from 60 to 65, if they're 70 cannot. So is there an age group yang myelofibrosis ni more common being diagnosed? Is it pediatrics age group? Is it geriatrics age group?
Certainly it's most common after 60.
All right.
But I think maybe 10 to 20%, 15 to 20% can be between the 50 to 60 age group. Okay. So I think it remains true that majority of patients are quite senior citizens when they are doing diagnosis.
So myelofibrosis adalah penyakit yang lebih kerap dijumpai dalam usia lebih kurang 50 hingga 70 tahun. What about bangsa, Doctor? Do we have numbers more common among Indian, Malay, Chinese?
I think we don't have very solid data, though they are from one of the preliminary survey, there seems to be Chinese is more common, but I think we need more study on that.
Right. What about jantina, male, female?
Male seems to be more common as usual.
Okay, thank God. All right. So, we're going to end this beautiful interview session, but I want to ask your opinion. Adakah penyakit yang jarang dijumpai, rare diseases, does it remain rare because one of the factors is that we doctors, the frontliners, we rarely think about it. We usually think about, oh, maybe it's dengue, maybe it's malaria, the more common one, and then we miss out the rare ones. What's your opinion about that, and what's your answer for that?
I think years ago, my professor used to tell us what the mind does not know, the eyes do not see. So that's something to think of. Of course, like all doctors, I think we need to be reminded, because it's something disease that we can do a lot, meaning that we can improve the quality of life, we can potentially cure some of the patient as well. So there are new medicine readily available now, and so I think that's something that we should look out for. Yes.
Alright, okay. So, message yang sangat besar, berat dan penting untuk kami, doktor-doktor muda, the frontliners, the GPs, MOs and emergency doctors, that rare diseases, sometimes kita tak terfikir pasal benda tu. So, when we see an unexplainable anemia coupled with splenomegaly and there are symptoms to it, I think it's important for us to do what Dr. Ng said, to remember that we have to send a peripheral blood film and refer to a hematologist for further, because I heard it's very difficult, bone marrow aspiration. Alright, Dr. Ng, I don't want to miss this opportunity. Yes. Can you give us a last reminder from a senior medical practitioner, from a hematologist, to the viewers out there, to the netizens out there, and to fellow doctors in medical fraternity in relation to myelofibrosis and myeloproliferative disease? What's your tips and reminders in order for us not to miss this disease?
I think, as we mentioned earlier, if we have suspicious pointers, meaning that if a patient with unexplained anemia, if you palpate, you have an enlarged spleen, then I think it's important for us to work the case out, meaning that we should tell the patient perhaps we have to do a few more tests to get the diagnosis right. Once you get the diagnosis, I think it's important that we work on it to stratify the risk and see which are the patients that require urgent treatment in terms of possibly bone marrow transplantation at one extreme. But of course, for the majority, and then probably optimal treatment is important. And there's always hope.
All right. Okay. Last question, doctor. If I fast rewind 45 years ago, would you still choose hematology?
Me? I think a lot of things is serendipity. Because I'm lucky to have a good boss. Right. So I would say your boss is not good, then you end up not too strict.
So 45 years ago, still hematology, yes. Alright. Pesanan yang sangat penting daripada Dr. Ng, jika anda kenal sesiapa dalam lingkungan umur lebih kurang 50 hingga 70 tahun, ada masalah seperti anemia, limpa yang bengkak, pergi berjumpa dengan doktor berdekatan dengan anda, sesegera yang mungkin, dapatkan pemeriksaan kesihatan fizikal, ujian darah sebaik-baiknya full blood count dan juga peripheral blood film, dan jika perlu, anda akan dirujuk ke pakar darah berdekatan hematologis untuk pemeriksaan seterusnya. Ingat pesanan Dr. Ng, apa yang minda tak tahu, mata takkan tengok. So, kesihatan bermula daripada kesedaran. Tanggungjawab kami untuk berkongsi ilmu, peranan anda untuk cakna selalu. Terima kasih daripada saya dan Dr. Ng.
Thank you.